Hello, this is Kim Jong-il. This is the second lecture on the double arch wires DAW, focusing on the fabrication and control of the double arch wires. There are two types of the intrusion arch, the utility arch wire and the double arch wires. The utility arch wire consists of one arch wire, which is directly engaged in the anterior bracket slot to intrude the incisors. On the other hand, the double arch wires are composed of two arch wires, and the activated main arch wire is ligated to the anterior section arch wire for intrusion. The intrusion arch is mainly used for cases of steep UOP. The main arch wire is made as 0.C160022 SS, and the anterior section arch wire is normally made from tooth number 2 to number 2 of the maxilla. Likewise, the 0.0160.22 SS arch wire is used. One of the biggest advantages of the double arch wire is that it not only intrudes the maxillary incisors, but also extrudes the maxillary molars. This can flatten the steep UOP. The extrusion of the maxillary molar can be considered as a normal procedure during growth and development, which allows the mandible to be located further anteriorly. The double arch wires can be bent into various shapes. The basic arch wire intrudes the maxillary anterior region. The helix can be bent like example A or B. However, if we bend the helix like example B, the wire may be extended, but the helix is likely to be pressed against the gingiva. We must remember that the loop should not press on the gingiva when we use the double arch wires. This is why I personally prefer short loops like example A. Let's first discuss the fabrication of the main arch wire. Prepare a 0.0160.022 SS straight wire and turret with 0-degree torque. Mark the center and the contact point between the maxillary tooth number 5 and number 6, or between the maxillary second premolar and tooth number 6. Now bend the helix. Wire bending like this is not very difficult. Because it is a little activated, bending is quite easy. Then we apply the arch form. Secondly, let's look at the fabrication of anterior sectioned arch wire. We need a small arch wire because we're only bending maxillary 4 incisors. Turret to 0-degree. Mark the contact points between tooth number 2 and number 3, or tooth number 2 and number C. After marking, bend the loop inwardly. This is how it looks when placed in the oral cavity. Bending the double arch wires like this is not very difficult. We need 60 to 80 grams of force to intrude maxillary 4 incisors. The magnitude of the force after activation can be evaluated with a force gauge. After activation to push the anterior region upwards by 8 to 10 millimeters, we can ligate the anterior section arch wire here. What we must concern about is the posterior alveolar bone is inclined outwards, so please make sure that the loop is not pressed against the gingiva. There are crown lingual torques in the maxillary first and second molars. We must bend the wires to fit this shape. First, we must turret the front part of the arch wire. Mark between maxillary tooth number 5 and number 6 and bend the helix. If it is 0-degree torque, the rear part of the wire will pass through the center of the plier. But if it is a crown lingual torque, the rear part of the wire will be located below the center. To apply a crown lingual torque, the crown must be twisted to incline lingually. If we bend like example B, the torque will be applied incorrectly and be pressed against the patient's gingiva. When bending like this, we must adjust a lot from the chair side. The loop normally faces outward when we bend the mio. But in this case, we must bend the arch wire inwards after bending the helix for it to not press against the gingiva. Just to review, we must mark the contact points of tooth number 5 and number 6, bend the helix, and bend it inwards. The DAW needs to be activated. There are largely two areas of activation, Area 1 and Area 2. In Area 1, the activation is normally applied about 30 degrees. This will intrude the maxillary anterior region. When we activate Area 2, the maxillary molars will be extruded and distally angulated as shown in example C. What are double arch wires normally used for? Cases of deep bite. Cases of Class 2 Division 2, cases of steep UOP. In such cases, intrusion is required at the maxillary incisors to flatten the steep UOP. In this case, which area should we activate? We should activate Area 1 so that the front of the helix is raised. For cases of Class 2 Division 1 with labioversion in the maxillary incisors, the activation area should be different. In such cases, tip-back activation at the rear of the helix loop should be applied at Area 2. For cases of Class 2 malocclusion with labioversion in the maxillary incisors and deep bite, I use twin block appliances. So activation as shown in example B would be unnecessary. Remember to activate as shown in example A. When activated, the front part of the helix should rise by 30 degrees and move 8 to 10 millimeters upwards. It is recommended to cinch back at the rear after applying the double arch wires. If not, the arch length will increase and the molar will experience distal crown movement and mesial root movement. The incisor will also experience labial crown movement and lingual root movement. It is recommended to cinch back loosely, not tightly, so that the patient is not too uncomfortable. The teeth move differently depending on where force is applied. The tooth movement we normally want is B1, B2. For cases of Class 2 Division 1, we can have B3 movement by locating the rear of the loop of the maxillary anterior section arch wire further backwards. However, I personally use twin block appliances for such cases. For cases of Class 2 Division 2 with deep bite, the maxillary incisors may incline labially during intrusion. For most cases, it is best to make an anterior section arch wire, as shown in B2. This will intrude the maxillary incisor and move both the crown and the root towards the palate. Squeezing the loop of the anterior section arch wire can prevent the wire from falling out and effectively intrude the maxillary anterior region. While using the DAW, we can separately overlay arch wire on the lateral tooth group. It can be leveled by using the 0.016 NETI arch wire as shown in the picture. If the vertical dimension of the teeth are different, it would be better to overlay arch wire like this. There is intrusion at maxillary 4 incisors. Eventually, the maxillary canine will be extruded. In this case, it is recommended to intrude the maxillary canine while intruding maxillary 4 incisors. We can litigate directly from the maxillary canine bracket with the maxillary main arch wire. From a clinical perspective, the intrusion of the maxillary incisors is often required. We must initially perform differential diagnosis. In Ceph analysis, if the U1 to lip line is longer than 5 mm, the UOP is bigger than 15 degrees. Clinically speaking, if the patient has a high lower lip line, in other words, the top of the lower lip is located on the gingival third instead of the maxillary incisal third. If the interlabial gap is wider than 3 mm, intrusion of the maxillary incisor is required. We can always evaluate the aesthetics in the middle or the end of treatment and perform intrusion on the maxillary incisors if necessary. To perform this intrusion effectively, we can use the double arch wires. Thank you for watching.